worries for addiction, biggest worries for just failing out of school, or biggest worries for just bad health consequences. Is that true? You guys could do that? Maybe it's bigger than 10%. I don't know what the number is, but most of us can make the list of the biggest people, biggest kids we're worried about. And there may be 100 reasons why you're worried about the kid, but the biggest reason is because there's something bad happening in that child's life, whether it's emotional neglect, physical or verbal abuse, or some significant household dysfunction. So the ACE study came out of Kaiser. Kaiser actually does some of the best health quality studies in our country. And they look at 19,000 kids. These are middle class, mainly white kids in California. And they asked just 10 very simple questions, like, under the age of 18, did any of the following things happen to you? And I'm gonna, everybody should take their own ACE score. I've done it myself, but everybody should go online, get the ACE test. It's the next screen up. It's too small for you maybe to actually take it right now. You should know what your own ACE score is, and I ACE score everybody now because it has such a huge impact on their overall health outcomes. So in this study, people who had a high ACE score had bad health outcomes in every possible measure, not just chronic pain or addiction, but they were more likely to die early. They had more cardiovascular disease. They had more asthma. They had more of everything. So the study looks like this, wicked fast to administer. There's only 2 answers you can give, yes or no, and it just asks you a bunch of questions that have to do with what happened to you under the age of 18, okay? Is that in your handout, or is it just on the screen? Okay, but it's so tiny in the handout you can't read it, right? Okay. But just, it's on your phone right now. Just look it on your smartphone, get it, ask yourself the questions. And what it measures is abuse, either physical, emotional, or sexual, neglect, physical or emotional, and just general household dysfunction, mental illness, an incarcerated relative who lived in the household, a mother who was treated violently, substance abuse, or divorce. So I score a 1 on an ACE score. My parents were divorced before I was 18. That's all I score. And you will have kids that you take care of, and I have any number of patients I take care of who routinely score a 6, 7, 8, or 9, like horrible childhoods. And it's no wonder that they live in chronic pain, or they struggle with addiction, or they can't manage their depression or anxiety. Is that this is a setup for a lifetime of this sympathetic alarm response of, I am in danger for the rest of my life, because under the age of 18, they were in danger. That sets them up for a lifetime of struggle. Now, should this be administered to a 14-year-old? Not really, right? Because the real question is what happened to you under 18. But mentally, in your own head, you're running your own little ACE score on these kids, because a lot of you know what's happening at home, right? Everything should be done to reduce these scores. All of our healthcare dollars, quite honestly, would be best spent on this stuff, because long-term, this costs us billions of dollars. So if you look at the CDC has a huge section just on adverse childhood events now, but everything, this disrupted neurodevelopment leads to all kinds of health problems that have a hard time to get treated. So the bottom line is, and this is the bottom line I would tell you to talk to parents about, and so when you're running back home in Newburyport or in Yarmouth, a talk with parents, you want to talk early and you want to talk often. And the message should be delay, 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 or avoid altogether. I'm never going to say delay your heroin use. I'm going to say don't use heroin at all. I'm never going to promote that at 21 it's better. But guess what? Kids are going to drink. They are going to drink, right? That's just a fact. But if they can postpone their drinking as long as possible, if they don't have their first drink till 18, that's way better than 14. If they don't have their first drink till 21, that's even better. So on your thumb drive are all these very specific handouts, okay? And the truth is you can take any one of them, you can copy it, you can put your school name on it. Get it out there as fast and furious as you can. We're going to talk a little bit, we're going to shift just to straight narcotics and opiates right now, but this exact slideshow is there. The Find the ACE score test is on there too. So this is the way it started for us. I come from Franklin County. I work in Greenfield, and the front page of the little Greenfield Recorder started running stories. And the way it really happened is in December of 2012, I read the obituaries, because I wake up every day. It's the first thing I do is I read the obituaries, because I have a lot of old patients, and I need to know like who died in hospice last night, and the newspaper's the one who usually tells me. So I was reading the obituaries, and the obituary read that Ashley Sims, age 21, died of a heroin overdose. And I thought, oh my God, Ashley died. I knew Ashley's grandmothers. I've I've known them for a long time, and I knew Ashley's story a little bit, and I thought, oh my God, Ashley died, and her grandmother's told the truth in the paper about why she died. Because the obituaries don't read that way, right? We all read the obituaries, and they say, so-and-so, age 24, died at home unexpectedly, right? They say something because not everybody wants it out there, but I called those grandmothers right away, and I expressed my immense sorrow about Ashley's death, and I said, thank you so much for telling the truth about her. And those grandmothers were extraordinary. They went to the paper and said, you need to hear my granddaughter's story. They were grandparents who had raised their granddaughter the way many grandparents do. And that is her picture on the top left. And she died of a heroin overdose actually here in Boston. Not here in Boston, but here in Boston. So the story really got public because our local media did a great job of covering the story. Everybody knows that the story really begins, in the 1990s when pain was the fifth vital sign, and we said to doctors like me, oh, use as much OxyContin as you want. You should be using pain medicine for everything. People should have zero pain. That's your goal. That data was based on a study from 1986, a Sloan Kettering study out of Cornell, I think, that looked at 38 patients who were given opiates at high doses for a long period of time, in this study up to 4 years, which actually for chronic opiates, 4 years isn't very long. And it said, these were all for non-cancer, non-malignant pain, that only 1% of those people would get addicted. So this one study of 38 patients is the cornerstone of our pain is the fifth vital sign, and use as many opiates as you like for as long as you want, right? Doesn't that make you feel good about American medicine? Right? Really proud of this. Total disaster, as we all know. So what do we know? That is, the more opiates we prescribed, which is sales in green, the more people who died, which is that black line, and the blue line is the more people who entered into treatment for addiction. Right? And the truth is, we all knew that. 1% of people are going to get addicted. That indicates that actually being on an opiate is protective for addiction, which is insane, right? So, but that's what we did, every one of us. And someone said that it started in Peabody. I don't know where this thing started. I could tell you. I was part of it working in South Boston, in Quincy, in the South End, because that's where I trained. And I spent a long time there. And I was handing out lots of opiates because that's what we were told was the right thing to do. Half of the U.S. opiate market is for non-cancer pain, right? Lots of pain meds out there for 1,000 different reasons. It's the expectation. If you've got pain, here's your script for an opiate. I actually love this slide because it's a marvelous public health slide. And I know it's complicated, but this is, I'm a big believer in public health. I think what I do in my little office is tiny. What the public health world does is enormous when it comes to improving the overall health of our community. So what it says is we've done a really good job at decreasing death for a variety of reasons. Vaccines are important. We love vaccines. And we've reduced influenza and pneumonia because we vaccinate people. We've decreased the number of people who die of aortic aneurysms because we screen high-risk patients early on. We've decreased heart disease. We decreased motor vehicle accidents because we believe in legal mandated seatbelts. So those are places on the bottom part of that graph where we've made improvements. Where have we gotten worse? Most of the places where we have gotten worse have to do with the fact that people live longer. So more people die of heart disease or dementia or Parkinson's or Alzheimer's because they're 98. And something's got to get you eventually, right? The place where we've really done a terrible job is that we have a 276% increase in opiate overdose, right? That's a pretty big bar graph. It barely fits on the screen. So those of you who do public health work, starting in the 1960s, we began looking at big slides of how fat the country was. Do you guys remember ever seeing those giant slides of the entire country? And initially there were very few obese people, and then you watch the decade shift, then you realize the entire country is obese except for Manhattan and Hollywood, right? Like the whole country. This is a slide that's looking at drug poisoning, so not specifically opiates, but drugs of all sorts, benzos, opiates, a variety of things. And it shows us 1999 to 2000 data, and it's the red we're looking at here that's concerning. So this is high rates of drug poisoning. And on that first top US slide, you see Appalachia lights up red. Can you guys sort of imagine that one there? You could see parts of New Mexico. New Mexico is an area with a tremendous amount of addiction, both genetically and because it's so poorly resourced and this a big Native American population. So New Mexico and Appalachia lights up. You get yourself to 2004, 2005, and the country starts to get more red. Florida kicks in, the Northeast starts to kick in, more of the Southwest kicks in, and then you get just 5, 6 years ago, a lot of the country lights up, right? Those are really depressing slides. Everybody knows this, but look at the rates of opiate overdose versus motor vehicles. This is the story I tell, and I know a lot of you have heard me speak before, and I'm sorry you're seeing some of the same stuff, but you know, all of our opiates, in fact, 90% of our oxycodone came from Florida in the decade of 1999 to 2011. It all came from Florida, and I'm sorry for any Florida natives, but I get very irritable about public health in the state of Florida. You know, there are whole buses that would get sent down to Florida from Kentucky and Ohio, and they would say, I'll pay you $200, board the bus, we'll pay for your food, we'll pay for your hotel. You just have to go to any one of these pain clinics, because they had 900 freestanding pain clinics in strip malls where you could walk in, say, my right knee hurts, and walk out with a prescription of 300 of something. People would get back on the bus, hand their scripts into the driver, and those drugs would be back on the streets of Kentucky and Ohio, right, the next day. 2011, the federal government said, if you cannot manage the opiate problem, Florida, we are shutting off all federal funding to your state. No more highway money, no more school money, nothing. Get this under control. That made Florida pay attention. So they actually shut down most of their, not most, but a lot of their pain clinics. Lots of doctors went to jail. Because these were not places they just handed scripts. They had closets full of opiates, and you walked out with bags of things. So this is just the DEA coming in and closing down one of these places. So everybody knows this. Where do people get their drugs from? They get it from a family or friend, almost always. Where are your teenagers getting them from? A family or a friend. They're not buying this stuff on the corner. Not initially, they're not. It comes from their medicine cabinet. Everybody knows this because we've covered it already. Heroin is cheap. It's incredibly available. We've covered this one already too. There is not a single town or county that isn't struggling. And if you think your school doesn't have a problem, I'm telling you, you just aren't aware of it, because there's a problem everywhere at this stage. We've covered this already too. Massachusetts has continued to see a spike in heroin overdoses and death. And this is, the problem is there's no abatement on the flow of heroin. There just isn't, right? It's really there, it's really available. Kids have a huge amount of access to it, and I don't see that pipeline getting shut off anytime soon. So this problem we're in now, I think we're gonna be there 3 years from now too. Something has got to shift, but I don't know what it's gonna be. Again, overdose deaths, this is 2013, and then the 2014 projected numbers. I have to say a big shout out to the Baker administration and to DPH. They've been really good about really trying to get the data a lot faster now, and I appreciate that. You know, I know we think we're like in this epicenter and we're the worst place on the planet, but we're actually not. This shows just state by state the number of people who are prescribed an opiate. So those bright purple states, on average, every person in that state and it has at least one prescription for an opiate, but also as much as 1.5 prescriptions for an opiate in those states. Now, that seems a little crazy, but then ask yourself, first of all, did you get a prescription for a root canal last year? Maybe. Or for people who get 12 prescriptions a year, right, then they're offsetting those of us who had 0 prescriptions. But you can see that the South and Appalachia and the Rust Belt states have a huge amount of opiate prescribing. Massachusetts and most of New England in general is actually a lot lower. We should be lower than we are. But before you think that really it's all about Massachusetts and New England, we're just really paying attention to it. I can tell you those southern states are not doing what we're doing right now in their public schools. This is just a state that looks at a map of Massachusetts looking at our state town by town and where opiates are prescribed, so those very dark maroon towns. If you're good at the state, you can find your town. What you really see is I-90, Route 2, I-91. You guys seeing those highways? That's Leominster, Fitchburg, Worcester, Athol, Orange, Turner's Falls, Greenfield, and then you head south, Springfield, Holyoke, Worcester. I mean, like, you can follow the highway and you could follow where people are getting a lot of prescriptions. That's not where the doctor is based. That is where the patient is getting their prescription, okay? So it's not about where the pharmacy is. And on average, those are 1 per opiate per person in that town. There's a lot of opiates out there. I don't know why I show this slide. I know you're giving me my 10-minute notice. Are you giving me water? I have water up here, actually. I show this slide just because there's a lot of us counties represented here and that all of our counties are struggling. Worcester County is a big county. This is one thing that I know you guys could be even more fabulous than you already are at. And this is the problem, is that most of our kids who are going to get early exposure to an opiate in a pill form, like not heroin, are going to get it because it was prescribed to them. And where are they going to get a prescription? An appendicitis, a root canal, or a wisdom tooth extraction, or they break something. Those are the three places. Every now and then I get a hockey player who has a ruptured spleen or something more traumatic, but those in general are the three areas. Do I know when my kids I take care of have their wisdom teeth out? I have no idea. Nobody calls me about it, but the school nurses know that. In general, the school nurses hear that Johnny's getting wisdom teeth out. And the problem is that most often these kids are given a script for how many? Right, 30, sometimes 60, but 30. How many should they actually use, or do most people really use? Yeah, 1, 2, 5, like small numbers, but they're always given 30 for some reason. And the real problem is these kids are left home alone, right? So some of my favorite kids I take care of who have moved on to heroin, they say, I got my wisdom teeth out when I was 15, I was home alone, I drank that bottle of Roxicet, I got it in a liquid form, and it was the best day of my life, and why wouldn't I stop it? And so I kept calling for refills, and I kept getting them. So this is the conversation that really should happen from the school nurse angle to a kid home with wisdom teeth. Is like, hi, is mom home? Dad home? Okay, I'm going to call them because you shouldn't be home alone managing your opiates. That's the message that should be given to parents. Who should really give them that message? The surgeon and the oral surgeon. Here's your script, Mom, for John's wisdom teeth. You should manage it 100% of the time. I expect with my 6 that I'm giving you that they will convert to Motrin in 2 days. And if they're not, then I would think something's wrong with the mouth and I want to see them again. Okay? But guess who doesn't do that? The surgeons don't do that. The surgeons and the oral surgeons and the dentists, I'm not faulting anybody here, but they need a lot of training, a lot of training. And I go out and I do those talks to them, and I am as mad at them as I am right now, and I just give it right at them. And they sort of, the oral surgeons and the dentists are like, oh, we didn't know they didn't use all 30. And I'm like, seriously, guys, figure it out. Do a survey monkey on your last 2 weeks of your root canals for an adult or a kid, and just ask the question, one question. How many of the pain pills I gave you did you use? And if the answer is coming back at 1, 2, 4, or 6, done, right? 6 is your limit. You should never be writing for 30. If you're doing a bone graft on a complicated jaw cancer, you're going to write for some opiates for real, but that's not the vast majority of these things. So appendicitis, I actually will know about appendicitis, and I'm thinking about a case I had recently. A girl had an acute appendicitis, got taken out, she was given her opiates, sent home. What did I know about the girl that the surgeon didn't? I knew she had acute anxiety and depression, and she was really struggling in school. So I get the note within 8 hours she has her appendix out and she's at home, and I'm freaking out because I'm like, wow, who's taking care of her at home? She's a setup for becoming somebody who's going to struggle. So I call her mom, I call my case manager, and because I'm a doctor who's really paying attention to it, I really jump myself into it to say, this girl is not to control her own meds. I want her off these as fast as possible because she's the kind of kid who's going to feel better, and I don't need her feeling better. You guys have that kind of insight too, but we have really got to change the way that people are prescribing, and again, that's my end of the world, and I work on it really hard, but you can make a big influence, and you can make an influence in your community. I really think the oral surgeons and the dentists need to come to some trainings and learn how to prescribe better. I just want to quickly spend time here, which is what addiction is, because people get very confused about what addiction is. Everybody who uses opiates chronically is dependent on them, okay? How long does it take to get dependent? Not long. 3 weeks, 6 weeks, it depends on you. It depends on the way that your body metabolizes things. But you know what? That's not a very long time to be on an opiate. That's like a bad hysterectomy. Or bad bunionectomy. There's a bunch of surgeries that involve a long time opiate, a hip replacement or a knee replacement. You may be on opiates for a while. Surgeons never bother to tell patients they're going to become physiologically dependent on the drug and are going to have active withdrawals when they stop. I'm trying to teach them to do that. Addiction is a different disease than dependence, okay? Addiction is the loss of control, compulsive use, continued use despite harm, and having cravings. And I spend a lot of time talking to people with chronic pain who use opiates, telling them that you, my friend, are doing fine, and you, my friend, have lost control of this drug, and we need to treat you for the disease you really have, which is chronic pain plus addiction, and not just pretend this is chronic pain anymore. Signs and symptoms you're going to see at school. This is in your handout. This is on your thumb drive, but smaller pinpoint pupils, an overall unhealthy look, starting to fail, depression, weight loss, vomiting, constipation. Opiates are very constipating. If they're nodding off, the teachers may tell you that kids are nodding off in class. That's a real concern for me for using an opiate or another sedative. Females not getting their period, you may or may not know that, but the one organ besides the brain that the opiates has an impact on is the hypothalamic pituitary tract, so it screws up your hormones. So signs at home, and this is the kind of stuff that you would talk about to parents in your schools. More time away from home, secret phone calls, obviously trouble with the police, missing money or valuables, bottles of bleach or vinegar, cotton balls because you're trying to clean your equipment or clean your skin, aluminum foil, chewing gum wrappers, burn marks, anything you're trying to cook the stuff off. I tell parents will come to me. Parents are clueless, right? Everybody knows that. But parents will come to me eventually because I'm seeing a kid and they're like, we had no idea. And I don't know anything about this. We had no clue. And then I looked under his bed and I found 1,000 little glassine bags, which are those, I don't know how, those little waxy bags that it comes in. And I thought to myself, wow, I don't enter my kids' room that much either because their room is disgusting and dirty and I get mad every time I walk in there. But now routinely, once a week, I actually do go in, I look under the bed, I look in the closet, and I'm not being snoopy, I just want to make sure there's anything there that shouldn't be in there. Signs and symptoms of withdrawal, diarrhea, sweating, very big pupils that are filling up the entire eye, irritability. This is stuff you may see at school. Who does not have Narcan in their school? Wow. That's not what I expected to see. I thought a lot fewer hands would be going up. Are you working on getting Narcan in your school? Okay. So I want to say that every school should have Narcan in their school, done, like without any question. I swear, if your superintendent or your school board is giving you issue, I literally want to call them myself and I will do that for you because it is much more likely that you're going to use Narcan in your school or at a basketball game than you're going to use an EpiPen, quite honestly. And there is no way to wake somebody up from that deep slumber of respiratory failure without Narcan on board. You can do as much rescue breathing as you want and call 911, but we're talking about blood flow and oxygen to the brain, and you have minutes. And everybody should have Narcan available. Narcan is available without a prescription at every Walgreens now in the state and almost every CVS. You can walk right in and say, I need my Narcan. It will be covered by most insurance, including Mass Health, where there's a $365 copay. This is relatively new news, but in the East, Walgreens has been running it for a while. In the West, we've been getting more Walgreens. CVS signed on recently. And I tell you, parents, if you have any parent who either has an active addiction themselves or a kid they're worried about, they should have Narcan at home and they should know how to use it because it is the most straightforward thing around. It really is. So there are schools that have Narcan, right? Can I see those hands? So way fewer schools have it than schools who don't. I'm sorry, I think the Department of Public Health should mandate it in the schools, and there should be no conversation about it. I know you guys are public health officials. When you show up at a public event, if there is somebody who crashed to the ground, I know that the nurses in this room would be the first one at that body, and if you're not carrying Narcan on you in your community, you need to. It's in my purse right now. I carry it all the time. I carry it to every event. A doctor I work with was driving home the other, 6 months ago, and he stopped to get gas, and he looked to his right, and there's a nice young woman who's blue on the ground. He starts chest compressions. He calls 911, and the whole time he's saying, God damn it, it's an overdose, and I don't have Narcan. And he's a guy who's been very ambivalent about addiction in general, and he got Narcan for everybody. It's in his car. He carries it all the time. When we do talks to doctors, we make sure everybody has it. But my doctors I work with really don't need it. You guys really need it. So Good Samaritan laws, there's nothing that will harm you about giving Narcan to anybody in this state, even if they didn't have an opiate overdose. Is it going to hurt them? No, it does nothing to them. Just give it. If somebody's not breathing, if you have any concern at all, you give them Narcan. These are the Good Samaritan laws. You can find this all online. Prescribetoprevent.org, I think, is the best website on this subject. It's run by Alex Wally and Boston Medical Center and Department of Public Health. Put this together. I think it's Department of Public Health, but it may be Boston Department of Public Health. I can't remember that. But on it are videos that you can show parents. And I actually, if I were doing a parent talk at my local school district, I would actually show them some of the videos of how to assemble the kit because those of us who aren't nurses, it's like, oh, there's a syringe, there's a thing you got to pop off, there's something you got to screw on, and most people don't know how to do that because the assembly is the trickiest part. And it shows you how to assemble it, it shows you how to administer it, it shows you how to give rescue breathing. Prescribetoprevent.org, it's excellent. This is a picture that comes from there, I presume. So I'm telling you, if at a minimum, one of the things I would love to have happen come September is that every school really has Narcan available to you because, you know, I don't care if you have one kid who's abusing an opiate in your school. That kid is at such high risk of an overdose that there is no excuse. Can you imagine if a child overdosed in your school and you were not able to rescue them? Can you imagine what that would look like? I mean, if there was one kid with a peanut allergy, you'd have an EpiPen. Everybody would, without any question. So we have standing orders for Narcan. Is that on that little thing? So the standing orders are like the doctor's orders. I wrote them one night at midnight and said, okay, school, they're signed, get the Narcan. Just take the standing orders, change the name, change it to anything you need it to be. I don't personally think you need to ask anybody. It's a medicine that your medical director of your school should sign off on without any question. If you think you really need to jump through all the hoops of going to your school board, I challenge you on that. Are you asking them about all the other medicine you have, your Tylenol, your Benadryl, your topicals? I doubt it. So figure that one out, and I'm happy to advocate. If you need me to make phone calls, I'll do it. Okay, I finally am done, but I am happy to take questions. I appreciate that you guys are standing, but honest to God, that you guys are doing the incredibly important work every day on the ground that's going to change this. I'm telling you that I'm not seeing any positive shift in many ways. Yeah, we're cutting down the pills, but changing the way that both parents and communities and children view these drugs, that's falling on your laps, and we need to get you the funding to make this happen. That's the most important thing. So I'm happy to take questions. Do I have time? Or not really? It's your call. A few. Okay. One or two, but I'm going to be around afterwards too. Yes. About fetal alcohol syndrome? Okay. Oh my God. Yeah. So what is the worst? Okay, you're welcome. Fetal alcohol. What's the worst drug in pregnancy? Is it cocaine? You know what? Those crack baby covers of Time magazine in the 80s, those babies actually did fine. Long-term, babies exposed to cocaine are fine. How about opiates? Yeah, you know what? Women who are addicted to opiates during pregnancy, it's actually a marvelous time for them to achieve sobriety. They're very motivated. Really great obstetricians and midwives all over our state are working incredibly hard at helping women get sober. And those women want their children so desperately that they will enter into treatment, and they often get better. It's a marvelous magic time where we can help women. In long-term opiate exposure in the newborn, those babies do fine. We have 20 years of data out of Boston City Hospital and Boston Medical Center. Those kids are fine. They withdraw a little bit. We get it. We give them meds. We get them through that. The worst drugs in utero, alcohol and nicotine, by a long shot. A long shot. And so I'm not going to go on and on about nicotine, which is terrible in pregnancy, but alcohol is terrible in pregnancy. And, you know, obviously, a sip here and there is not causing fetal alcohol syndrome. That's not what we're describing. We're talking alcohol abuse during pregnancy. And fetal alcohol syndrome is 1% of our kids. It is diagnosed something like 0.001% of the time, right? We don't ever pay attention to it. You guys actually could diagnose it better in the schools because the #1 presenting symptom is major learning struggles, major learning disabilities. Yeah, there's some facial feature stuff, but you guys know it better than we do. And those kids do not thrive. They do very poorly in terms of academic achievement. And everything should really be done about getting women off alcohol and off nicotine during pregnancy. I'm not promoting cocaine use, but fetal alcohol syndrome has a huge impact on our schools. So 1% of the kids you have, depending on your community, it may be higher. But I tell you, the doctors taking care of those kids, they don't have that diagnosis. We underdiagnose this. It's extraordinary. There's a question closer to, yep. So almost everybody starts by snorting it. And that's part of the problem, is that there is a sense of reduced risk and harm with snorting it. And kids will say that to me. They'll say, I only snort it. I only snort it. I hear that all the time. I hear it in the courts. I hear it in my office. And I say, you know what, my friend? It is no different whether you snort it or you shoot it. It has the exact same impact on the brain in terms of its addictive nature. It works a little bit faster if you inject it. So snorting it is really easy, and most of the kids you take care of initially in the school will be just snorting it. Again, I just said the word just snorting it, and I apologize for that, because it's not, it doesn't make it less risky. So it comes in a pure powder. In the Northeast, we have really lovely pure heroin. It's part of our problem. The West has more black tar heroin from Mexico. It's not as good, quite honestly, which is why methamphetamine is done better in the West, and why, by and large, we do not have a methamphetamine problem in New England. I am grateful for that in general, because if you think heroin breaks the nucleus accumbens, when I showed you that slide that showed you 12 to 300 dopamine on methamphetamine, methamphetamine brains don't usually heal very easily. They're really, really broken. So then after a while, you find that you're just not getting high enough, or actually you're not even able to treat your drug sickness by snorting it, then it's used injectably. You could buy syringes at any pharmacy. They're easy to get. There are good needle exchange programs. Our Hep C rates are through the roof. When I was in Boston, the Hep C rates with injectable drug users was 95%. But in the rural part of the world, our Hep C rates hadn't been that high, but in the last 2 years, they're starting to skyrocket. And if you inject, you have Hep C as far as I'm concerned. It's that prevalent in our community. Okay, Marianne's saying no more, but I'm going to be somewhere when we're done, all done, and I'm happy to answer more questions.
Can you see why we invited her here today? She's a true advocate for the work that we do as well. And I just want to echo her words. If you do not have Narcan available in your schools, we at the School Health Unit, Department of Public Health, have those resources available for you. Our regional consultants have all been trained as trainers. Just call up your regional consultant and they can come to your school and provide you with the training that school nurses need to access Narcan and all the paperwork. So Kathy's going to tell us about our break.
Quick things. We're going to have just about a 10-minute break. Dr. Potee, you are just amazing, and thank you so much. She's all over the state. She's like a one-arm paper hanger at this point. You are going to have a break. I did ask them to put water out there because I thought we were going to have it on the table, so there's water out there. If you parked in the parking garage that way across the street, we do have $5 parking vouchers for you, so that will only cost you $5. So they're out at the table. If you parked at the other one, sorry, they don't own that one. And any of you that are in back, there are seats that are up here, so we want you guys at a table. So during the break, if you can come up and find a seat. We'll start again at 10:45. Thank you.
Jose, I didn't even get to say good morning.